Welcome to Mining and Analyzing Data from Social Media for Pragmatic Research. I'm Bethany Kwan. I think many of you have seen me before. And I'm joined here by Jenna, Reno, one of my collaborators who also uses social media for research in a variety of ways. Our learning objectives for this session are two. By the end of the session, you should be able to identify audiences and potential uses of social media in pragmatic research, to identify approaches to mining data from social media and the web for research, and to describe sort of at a high level some quantitative and qualitative analysis methods appropriate for social media data. And I want to start out by saying that we're not necessarily expecting you to walk away being able to go do this yourself, but to know what to ask for. So if you are going to approach someone who is an analyst, a biostatistician who can do things like these data mining types of activities, that you know what it is that you're asking for. I also want to say that neither I nor Jenna have any financial or other conflict of interest related to this talk, and specifically no financial interest in any of the platforms or third-party vendors for data mining that are mentioned in this talk. All right, so I'm going to turn it over to Dr. Reno to give us a little bit of background, and then I'll go through some examples. And we are going to make this interactive. And so if you haven't yet, download the handout for today. I put the link in the chat. I'll do it again. I think there was someone that joined after I put it in. So please have that on hand for when we get to the activity.
All right, great, thank you. So as you probably all know, there are lots of different social media platforms. Each different type of platform has some key differences, especially in terms of the types of users who it attracts. So just recently was talking with my own students about the fact that people used to think of social media as being a tool or platform for connecting with younger users, but we know that that is now more disparate in terms of where the younger users are, and that many older users are starting to frequently use some platforms such as Facebook. So Facebook is the most widely used social media platform worldwide, with this particular infographic says, I don't think this is specific to Facebook actually, 4.2 billion across all platforms. But we do know that I think I've seen numbers upwards of like 80% of Americans are on Facebook. So we know that these are ways that we can reach our audiences or our potential participants and subjects for conducting research. Next slide. All right, so there are different types of research that we can use, or different uses of social media that we can employ for pragmatic research, including the implementation and conduct of research. So we could think of social media as a way to connect with stakeholders or to do different types of community engagement. We can think of social media as a way to disseminate the results of our research, or to design messages that's specific to different types of stakeholders and different channels. And we could also consider social media as a way to recruit people. Although there are some, as Bethany and I have been learning more about lately, there are some caveats for using social media for recruitment. We also can think of social media as a source of data for our research. So this includes thinking about it as secondary use. We could use it for communication research, for comparing different strategies for communicating. You can perform what's called network analysis for understanding how different communities and groups of users are connected. You can perform ethnographic research by studying people in their digitally native environments. We can do different types of public health surveillance to see how people are communicating about their health behaviors, or as we've seen a lot in this past year, what people think about different public health strategies and whether or not they will go along with it. If they're a pro-masker or an anti-masker. And we can also find patient-generated health outcomes data where people are discussing their own health statuses. Next slide. All right, so opportunity for interaction. So based off of your own experiences or I don't know, thoughts that you have had in the past 10 minutes, 5 minutes, what would you think of as benefits of social media for research? So go ahead and put your thoughts in the chat. Of one idea of a benefit of using social media for research. Health behaviors, messaging, content analysis. Yes, messaging can be far-reaching. Recruitment. Lots of data available, yes. That is both a benefit and a challenge of using social media for research. So some other benefits of using social media for research is that you can collect data in real time. As we've already talked about, you can reach a large number of people. Potentially you can reduce costs for reaching people. You can understand what information people are seeking and what type of information that in particular they're engaging with. We can identify trending topics or ideas. We can do an environmental scan to see how people are talking about different topics or ideas. We can engage with our users via a tool that they already use on a daily basis. That's not something that that they're having to learn how to use just for the purposes of your stakeholder meeting. There are built-in networks, so that allows for this ability to share and reshare. There are also the existence of data mining tools that we'll get to in a minute that forego the need for transcribing. So if you've ever been tortured as a graduate student to perform transcribing, this might be particularly appealing. And there are methods such as natural language processing that can be provided to be applied to content analysis of large data sets. So you don't even necessarily have to do all the content analysis by hand if your data set is particularly large. Next slide. However, there are some challenges to using social media research. So similarly, let's try this again. What challenges do you anticipate or maybe have you faced in using social media for research? Recruitment biases, yes. Incomplete data, yes, different biases. Scraping data can be a challenge for sure. Any other challenges? Retention, definitely. So some challenges that we've thought about are inequitable access. So even though, as we've talked about, a lot of people are on social media, that doesn't necessarily mean that the distribution of demographically that people have equal access to social media. We know that not everyone has a smartphone or not everyone has a unlimited Wi-Fi or data use plan that allows them to be on social media. Selection bias, you've already brought this up. Data accessibility can be challenging depending on the platform that you're interested in. Non-standard data brings up different types of data quality and formatting concerns, non-traditional sampling, and other types of ethical considerations that we'll get to in a moment. Do you want, okay. So some ethical considerations, the authors here, Ford and all, provide a framework for thinking about ethical considerations. So things that you might consider or need to consider when conducting research via social media is, are data private or public? I know I particularly have been interested in I've worked on vaccination research, and I've been interested in different groups on Facebook that are specifically for having discussions about vaccination, but technically they're private groups. There are 40,000 people in this private group, but it's still a private group. So if I access that data, does that violate standards for how public data or private data can be used? That begs the question of consent. When should it be asked? Again, is this data public or is it not? Anonymity. So some people use their real name on social media, some people don't. And understanding, to what level are we required to protect anonymity when we're using data that is otherwise considered public? It's important to, again, weigh the harms and against the benefits, as with all things, as well as the public benefit that goes along with that. There are also legal concerns related to different social media sites. So Facebook historically has been a site that is much more protective of its user data, at least in terms of making it readily accessible to people who don't pay them or have some secret behind the scenes deal. But I definitely know someone who in a recent conversation about a proposal was like, well, I think I know a way we can access this data, but it would violate Facebook's terms and conditions. And I said, no, we can't do that. So again, needing to follow along, even if it's not a ethical, there are legal concerns with getting access to the data, and then governance of data, annotations, algorithms, linkages. Again, when is ethical approval needed? When do we have to take this to IRB, or when is working with social media considered exempt? Bethany, thoughts from others?
So I'll give you an example of a project that I worked on a couple of years ago, in which we used Twitter for the purpose of stakeholder engagement in research on palliative care for people with brain tumors. And there were a couple really important aspects of this project. Number one is I was partnering with an existing social media based community that's referred to as hashtag BTSM, which is hashtag brain tumor social media. And so it was really important in order to get access to this community that I have partnered with those who sort of oversee this community, these patient advocates. So Liz Salmi, who's the first author on this paper here, was a partner that I worked with in all aspects of this project. And what we were trying to do here is to understand what are different perspectives on how people in the brain tumor community conceive of quality of life. What does that mean? How might palliative care align with the quality of life needs in people with brain tumors and their care partners? And so with a lot of support from this community, so from this hashtag BTSM community, and then also another group that we collaborated with was hashtag HPM, which is Hospice and Palliative Medicine. Again, existing well-established groups with existing networks and people that follow and use these hashtags. We did what's called a tweet chat. And a tweet chat is like a focus group on Twitter. And just like you do in a focus group, you have some questions. And in a tweet chat, these questions are posed by the tweet chat host. These are well-known people who lead these communities. And one topic is introduced every 15 minutes or so. And so you can see on the left-hand side of the screen that here are the tweet chat topics that we introduced. This is a setup time. It's like 6 o'clock on a Sunday evening. People know to expect it and they come engage during that time. And then we were able to download transcripts of all of the tweets that used this hashtag BTSM during the time at which the chat was happening using a tool called Simpler, SYMPLUR. It wasn't free, but it wasn't terribly expensive. And so we were able to download transcripts of all of the chats that referenced this hashtag BTSM. We asked them to indicate which topic they were responding to. And then we were able to apply sort of standard qualitative content analysis. I think we had something like 22 pages of transcripts, and so several hundred tweets and unique tweets that we were able to analyze. And here's just a little excerpt here of the themes that emerged from our qualitative content analysis. So the overarching theme was this need to address quality of life in the context of healthcare and decision-making about treatment and support for care partners. And some of the specific sub-themes that emerged. So for instance, the healthcare system needs to provide better support for care partners. And then there was a quote here. So from someone identified as a care partner, Simpler is able to tell you what kind of representative, what kind of person this is. So the tweet said, it was so important to turn your head and look at the suffering caregiver sitting next to the patient and ask, how are you doing? There was another sub-theme that suggested that patients and care partners appreciate when providers discuss quality of life early, but not immediately at diagnosis, and wish it was really emphasized more. So a patient said, I don't recall the phrase of quality of life coming up specifically, but the side effects were clearly discussed pre-treatment. Having gone through treatment, now I realized if quality of life was emphasized to the patient, the process would have gone much better. So we had designation from our IRB that this was considered non-human subjects research because it's publicly available. However, we did go to every person that we directly quoted that participated in this chat, the ones that were still living. There were unfortunately some who had passed away, and said, is it okay with you if we use your direct quote in our paper? And they all said yes. And so even though we weren't required to do that ethically, we thought it was really important to alert them that we would be publishing on these data. We also, at the outset of the tweet chat, did tell people that we would be using this data to inform research and to conduct research. So again, we weren't required to do that, but we did feel that it was important to alert people up front that this was the plan, and then to ask for permission to use direct quotes, because you could easily search these and find out exactly who said this. Okay, so what we'd like to do now is sort of a mini exercise here. You have this in your handout that I shared with you. Let's do a couple of these things, a little bit of a thought exercise here. So the first thing here is to really know your audience. In doing that brain tumor research, I never would have known who to engage or how to engage. And so what I'd like you to do is, think in the context of your research, be thinking about who your audience is. Who are the influencers? What's the social media platform that's most commonly used in your context? So if you would, in the chat, if you would indicate, and I can't see chat, Jenna, so maybe you can, it's not coming up for me, so maybe you can indicate it. You can share what people say. So who has an example of a research topic you work in and a social media platform that you know is commonly used? Any ideas?
I do have a question in the chat. You said Simpler was what you used too?
Yes, yes, SYMPLUR, Simpler. I think it's on one of the upcoming slides. Does anyone have any examples? No, not feeling up to it.
Jen suggested intimate partner violence.
And what sort of social media platform are you aware of that that community might use, Jen? If you're not
Twitter
sure, what was that?
Twitter or Facebook.
Twitter and Facebook, yes. So if you're not quite sure what platform your community uses, that's a good opportunity to get out there, start asking questions, get to know and engage that community, and find out what's a good way to reach them. Okay, so now in our last 10-15 minutes or so, we want to talk a little bit about how do you actually get data from social media. And so very briefly, there are a few different types of data you can get from social media. First, there's unstructured data. So this is unstructured text or images. It's often considered more qualitative data. It's stored in what's called a native format. So native being exactly the way it was generated. And it might include things like social media post content. So the tweets that people use, this would be considered unstructured data. You might also have structured data. These are often organized in a named field, entered into like a form of some sort. They may be considered more quantitative. They may conform with a data model. There were some earlier talks today around what a data model is. And this may be things like social media profile data, like how old someone is, for instance, or their gender. And then finally, there's metadata. This is descriptions of the data or keywords. And an example of this is hashtags, which are considered user-generated metadata. So these are ways that the data have been labeled. And this can either be done by some outside party or it can be generated by the user themselves, as is often done these days. And so I'll just very briefly go through mining data from social media and some of the mining techniques. So you might do a sort of manual approach where you go in and you transcribe social media posts by hand. Ideally, there's some sort of API, third-party API application programming interface that you can use. And these are sort of free on Twitter. They have this, but it's only limited to 1% of tweets. And so I tend to go with these third-party vendors like this Simpler tool, Simpler Signals. You can see the link here. A lot of these are licensed with the platform for broader access, as Jenna was indicating. However, these can be very expensive. I think we paid something like $5,000 to access the transcripts for our Twitter tweet chats for the brain tumor project. And then there are some social listening tools that Jenna will share with you briefly on the next page. There's also, this is not my area of expertise, and so I won't go into a lot of detail, but there are these data pre-processing methods that can help with mining data from social media. And just a few of them you can see here. There's this idea of a named entity recognition and normalization. There's both automated and manual processes. And so these are tools that can help pull out named entities like drugs, diseases, medical events. They recognize the names of different types of health conditions or symptoms. Normalization is this process of mapping to predefined categories or standard medical ontologies. And so some of these pre-processing methods are programmed so that they're saying, well, this is a symptom, or this is a drug, or this is a procedure that's been performed. And then there's also techniques called dictionary lookup, where they're matching text strings to medical lexicons. And so they might be saying, well, this drug here is part of this drug category, and they're mapping onto existing medical ontologies. There are text mining techniques, extracting features of free text for further analysis. And this Engram, you can see an example of engrams on the right-hand corner here. So the sequences of letters and words that come together. So how often in your data do you see the letters T and O next to each other? Well, in the book Pride and Prejudice, there's 4,116 instances of TO next to each other. How often do you see the text string I am sure? These are 3 words next to each other. Well, there's 72 instances of that. So you can start to get a sense of how people are using language. And then there's something called fuzzy adaptive resonance theory, network-based information retrieval schemes. And clearly these are things where you would need someone with expertise, a biostatistician ideally, who understands and can generate these things and aid in interpretation. So Jenna, why don't you tell us a little bit about social listening tools?
Yeah, so social listening tools are primarily designed for businesses and companies who want to get a better sense of their customer base. And so they can use these data from social media to see how people are talking about topics or their brand. to help them better understand their customer base. So here's a list of different ones and kind of what they do and how they can use them, similar to what Bethany said. These can be pretty expensive depending on the amount of data or the type of user that you're trying to access, but can be used, as you might imagine, to think about topics and to gather data based off of a topic that you might be interested in. So as I've said, I've done a lot of work in vaccines, and as many of you probably know, people talk about vaccines a lot online and on social media. So thinking about how to access kind of primarily publicly available data in a synthesized way so that you're not having to go and do the work of developing an API to collect or to employ for collecting and mining data for your project. These are kind of another way to go for that. So I'm not going to go through each of them individually because you can see a brief overview. Again, they do pretty similar things, but each of them specialize kind of in different areas. You want to go to the next slide?
And so once you've actually mined these data, however you've gone about doing that, there are a variety of different techniques that you can use for analysis. As I described with our brain tumor example, we did a sort of standard qualitative content analysis where you load data into a qualitative analysis software and you can identify themes, code the data and identify themes. You can do that term frequency sort of analysis like that Engageme example I showed you. You can do a full social network analysis. I'll show you an example of that in just a moment. You can do natural language processing. Seth Russell gave a talk on that at COPRH. It will be archived if you didn't get to see it. It's a really good, but very advanced type of analysis. There's also various machine learning techniques that you can use. Again, you'll need someone who's an expert in that to help with that. And then you can do hypothesis testing, as you see here. Facebook has a tool that you can use to do what's called A/B testing. So comparing which types of messages or which strategies for posts are most effective. And so Facebook has a tool to allow you to do that. So really, who do you need on your team here? So if you're going to do qualitative and content analysis, you need a qualitative methodologist, or you yourself need to know how to do this. If you're going to do data mining, any network analysis, anything involving machine learning, you're going to need a biostatistician. If you are going to use social media to do stakeholder engagement, like I did with the brain tumor group, then you really want to connect with and engage and partner with someone who is a member of that community, who knows the processes, who knows what the standards are, who has that sort of gatekeeping liaison type of ability. And access. And so these patient and community stakeholder representatives, someone who's familiar with or part of these social media communities, can be really valuable. When I first started working in that brain tumor space, I didn't know what Twitter was, and I really needed someone who both was familiar with Twitter, who knew how to tweet, who knew what a hashtag was, to walk me through that process. I think I'm a little better at it now. So one other case example to share with you, this was another project where I worked with the hashtag BTSM community, and the lead author here, Dr. Feliciano, is a biostatistician, and so he did this social network analysis. And what he did is, again, using the simpler tool, downloaded every tweet for, I forget exactly how long, it was many years. Yes, looks like it was about 6 years worth of data. From Twitter, everything that referenced this hashtag BTSM community. And he did a network analysis and in order to show who's tweeting and how are they connected with other members of the community. Who are those major influencers, those major players? And you can see here, so the Liz Army, that's Liz Salmi, my partner. She certainly plays a major role in this community. MD Anderson News, they're from one of the major brain tumor cancer center treatment centers. NIH's brain tumor group, and BTS Tweets is the National Brain Tumor Society. The IBTA is another brain tumor advocacy organization. And then you can see a number of other sort of major players. And what this helped us see is both who are the messages coming from, who's helping to lead this work. So if we were to go share messages, disseminate what we're learning in brain tumor palliative care research, who do we want to go to encourage them to share our content? So really understanding these communication channels, how well connected they are, who do we need to reach to get out to these outer corners, can be a really helpful way of figuring out dissemination and messaging strategies. And then we also can tell what's the right timing, what are major events around which brain tumor content is being shared. So in the interest of time, I'll just reference the second activity in the handout for today. And so as you go to apply what you learned in this session here today, make sure you're thinking about the audience, the appropriate social media platform, and your research topic, and figuring out who is it that you need to partner with in order to conduct this research or implement your research. Be thinking about what data types might be available from the social media platform that's commonly used in your community. How might you mine that data? What sort of resources do you have available? How might you analyze that data? And who do you need on your team? So there are a number of references that were provided that I found really helpful in understanding kind of the gamut of the types of data available, the ethical considerations, and the different types of tools and techniques that you might use to mine data from social media for pragmatic research. So thank you, and if you have any questions, feel free to email us. I think we have time, maybe 1 minute for questions. How many responses did we get on the BTSM tweets? It's like 234 in an hour. Any other questions, comments? Looks like I have 2 minutes.
One thing that we didn't touch on is there are also methods that you can use that allow users or maybe participants in a study to give you access to their social media. This is usually used for collecting trace data. You can collect their data, but not their friends' data or people in their network. So that's another option. If you are particularly interested in how your subjects are participants in a study, and you can link it to survey data, that type of thing.
So Simpler did not supply the charts. That was generated through a social network analysis tool that Dr. Feliciano applied to the data. They give us more raw data. All right, well, thank you, everyone. I'm glad everyone stuck it out for day 2 of COPRHCon, and that you'll come back tomorrow. We're almost